The presenter is James R. McKee, DDS of Downers Grove, Illinois.
The reality is that all these patients have temporomandibular joint problems that need to be addressed and treated. And if we look at the picture on the right, we can see what the MRI of a structurally intact joint looks like. The condyle, the disc, and the eminence have been outlined, so you can see that easily. The second type of joint we see is a structurally altered joint. As we look at this video clip of a cadaver dissection, please note the following items. Doppler auscultation gives us an opportunity to listen to the tissues rubbing against each other. And now we'll hear noise on translation, lateral pull. The final segment of the TM occlusal exam is the imaging portion. And generally today, if a joint needs imaging, we'll use two modalities. One will be magnetic resonance imaging, or MRI, and the second will be three-dimensional cone beam imaging. 3D cone beam imaging has offered exciting new possibilities in terms of diagnosing temporomandibular joint problems. And when we look at Abby's right condyle, you can see how small the condyle is. As we look at Abby, on the right side, her ramus length is 49 millimeters, a marked reduction in terms of the growth of the mandible. If we measure from Abby's tympanic fissure to the mesial contact of the maxillary first molar, we see a fairly normal number of 78.4. Let's begin by looking at cases that have structurally intact medial poles. That would be a Piper stage 1, which is a structurally intact joint, a Piper stage 2, which would be beginning lateral pole breakdown, a Piper stage 3A, which is a